Hello, everybody, and welcome to the KT Canada Seminar Series. I'm Genevieve Creighton, Manager for Knowledge Translation at the Michael Smith Foundation for Health Research. The presentation today is How to Know It's Working, Developing an Organizational KT Evaluation Framework. And we are very pleased today to have presenters Penny Cooper and Gayle Scarrow with us. Penny Cooper is a professional evaluator with over 20 years' experience in evaluation and applied research. She is the Director of Evaluation and Impact Analysis. She the former, not current, Director for Evaluation and Impact Analysis for the Michael Smith Foundation for Health Research, and currently works as an independent consultant. Penny is deeply engaged in the evaluation of KT initiatives through her ongoing relationship with MSFHR and other BC-based clients. Gayle Scarrow is the Director of Knowledge Translation at MSFHR. She leads development, implementation, evaluation, and ongoing management of MSFHR's Knowledge Translation Plan for the purpose of fostering and accelerating the impact of health research in BC and beyond. So today's presentation will be around 40 minutes, after which you are welcome to ask questions. If anyone at a site or an individual has a question, please let us know by contacting the KT moderator via the chat box. And I would like to remind people to please keep your microphones on mute. Okay, so let's get started. Welcome.
Hi, everyone. Thanks for joining Penny and I today. Oops. So we're just getting a little technical difficulty here. One moment. Okay. So the way we're going to do this is to lay out a step-by-step approach for evaluation of a program of KT initiatives using the Michael Smith Foundation for Health Research's Organizational KT Evaluation Framework as a concrete example. We're going to start by just giving you a bit of background about our organization and our role in knowledge translation, just so that you have some context for understanding the example of organizational evaluation that we're going to be talking through. We're then going to switch gears a bit and start the conversation about organizational KT evaluation. We'll start by offering a couple of key definitions. We're going to take you through a general approach that you can use for planning and conducting programmatic KT, identifying where you might come across challenges and how to address them. And then we'll finish up with time for questions. So the Michael Smith Foundation for Health Research is BC's health research funding agency. We're funded by the province of British Columbia and named in honor of Dr. Michael Smith, who's BC's first Nobel laureate. We're also a member of NAPRO, the National Alliance of Provincial Health Research Organizations. What we do, we fund BC health research talent, partner to increase funding available to BC health researchers, support KT in BC, and respond to BC health system priorities. Oops, one too far. Underpinning our strategic plan is an increased focus on KT as a way to facilitate increased development and use of relevant health research evidence in complex systems. Our definition of knowledge translation is using health research to improve health. It refers to a broad range of initiatives meant to improve the use of research evidence in practice, policy, and further research. Sorry, it's very sensitive. It's a very sensitive keyboard here. To determine how best we could support KT as a health research funding agency, we started by looking at the evidence. Based on recommendations from the literature, an environmental scan, broad circulation of an iterative discussion paper, and an expert working group process, we developed a plan to maximize our role in KT. What we learned is that the best approach is to consider what needs to happen overall for successful KT. Key to the process was development of a model comprising 5 key functional areas that we feel together create the conditions for effective knowledge translation. Those are advancing KT science, building KT capacity, managing KT projects, funding KT, and advocating for KT. Supporting activities include the assessment of stakeholder KT needs, the evaluation of KT activities, and communication of KT activities. There's lots of hands in the KT pie at Michael Smith, with some obviously more involved than others. The KT unit is the primary group for delivering the Foundation's KT activities, but as other departments are also involved, and they include communications, research competitions to manage our funding programs, the strategy team, which is comprised of evaluation impact analysis, partnerships, and research programs design and development. And last but not least, our President and CEO, Bev Holmes, who is a researcher and has worked previously as a health communications and KT consultant, and still regularly publishes and presents internationally on how best to support the translation of research evidence into policy and practice, especially from a funder's perspective. In 2016, the Foundation's KT work plan recognized there was an opportunity for us to be involved in the movement on measuring the impact of health research. Evaluation of our activities has been limited to sponsored KT workshops and the KT activities of our funded award holders through annual and final reports, for example, the outputs, the outcomes, and the short-term impacts. In light of MSFHR's organizational strategic plan, organizational evaluation strategy, and related reporting to government, and to inform development of the organization's KT activities, a KT evaluation framework was required for evaluating the activities across the organization with a focus on the work of the KT unit. And that's where Penny came into the picture.
So at this point, we're going to take a bit of a step back from the specifics of the Michael Smith Foundation's KT evaluation situation and just kind of make sure we're all on the same page with some important definitions. So as if knowledge translation didn't already have enough challenges with terminology, we need to add another one to the mix for the purpose of this conversation, because evaluation has different meanings for different people. The way in which we mean it is using the definition from the Canadian Evaluation Society, which, if you've not come across it, is Canada's professional association for the field of evaluation. So when we're talking about evaluation, this is what we mean. Evaluation is the systematic assessment of the design, implementation, or results of an initiative for the purposes of learning or decision making. So let's break that down a bit. When we talk about systematic, what we mean is that an evaluation is methodical and is providing information that's credible, reliable, and useful to enable the incorporation of lessons learned into your decision-making process, the decision-making processes of users or funders. When we're talking about assessment, we're talking about considering the value, the merit, the worth, the significance, or the quality of something. So it may also aim to identify what works, for whom, in what circumstances. When we talk about initiatives, we're really saying there that evaluation can focus on any kind of initiative, including programs, projects, subprograms, subprojects, their components or elements, or something bigger, which is like the, an organizational function, which is partly what we're going to be talking about today. We also need to think about, well, what do we mean by organizational KT evaluation, and specifically, how is that different from evaluating KT programs? All it means really is that you're evaluating a program of KT activities rather than individual projects, programs, or activities. So if you evaluate KT at the level of individual programs, that's great. It's going to tell you how those individual programs are going. But if you need to investigate or tell the story about your whole KT program and how that's going, how all the puzzle pieces fit together to tell the story, then you need organizational KT evaluation. So why do we need a framework for organizational KT evaluation? Firstly, what it is, it's a framework that brings together all the puzzle pieces in a cohesive way so that you can tell your organization's KT story. A really important thing here to note is it's not just about having a framework. The process of building that framework can be a really useful way to get everyone on the same page with articulating what it is you are actually even trying to achieve with your KT program, how the pieces are meant to fit together, what might be missing, and maybe most importantly, understanding for all the people that are involved in your KT work, understanding what's important to each other. So the process is as important as the outcome. So we kind of approach this there in sort of 7 steps that you can use to once you've identified that you have a need to do an organizational level evaluation of your KT activities. It's a systematic process, and if any of you have done evaluation before, you'll probably recognize these key steps. They're no different for evaluating organizational KT than they are for any other kind of evaluation. So each step revolves around answering a key question. And if you want to be successful, it's important to ask yourself all of these questions. It's also important to preserve more or less the order of the steps, because apart from steps 1 and 2, which kind of happen together, the answer to every question depends on the answers to the preceding questions. And everything that you do in terms of developing your framework should flow from the purpose of your evaluation, which is question 1. and how it's going to be used and who's going to use the results. So let's look at each of these steps in a bit more detail. So really the first thing you need to do is really ask yourselves, why do we need to do this? What purpose is it going to serve? We found that many conversations about organizational KT evaluation start with, oh, we really should do an evaluation of our whole program. But why? How are you going to actually use the results? It's a lot of work to do it, so you need to be clear about what your purpose is. And once you start talking with people, and especially when people start to get excited about it, which is really what you want, you might suddenly find that there are many purposes that your evaluation could serve. So it's really important to hone in and determine what is the most important purpose. Step two, as I said, is more or less happens at the same time as step one, because you need to identify and engage your key stakeholders to start developing probably the purpose of your evaluation together. So you need to ask yourself, so who are our key stakeholders? Who are the key stakeholders in our organizational KT program? And from there, you can then derive, okay, so who are going to be the key stakeholders in your evaluation? So you're going to have internal stakeholders. You're going to have external stakeholders. The internal stake, depending on how big your organization is, your internal stakeholders could include your executive leadership team or your board of directors. Equally, if your organization is really big, those folks might be considered external stakeholders. It doesn't really matter. You need to consider who are the important people who are interested in your program and who are going to have a stake in the results of what you come up with when you eventually actually implement your evaluation. You also need to think about who's going to use the results of the evaluation. And that may just be a small group. It may be a group of the people who you're most directly involved in KT implementation. So really you need to kind of identify who is going to be your primary user. And ideally, you really want to start engaging with your key stakeholders right at the beginning of your evaluation and then keep them engaged at appropriate levels through every step of the evaluation, because that's really the best way of making sure that your organizational KT evaluation is going to meet the needs and the expectations of your most important audiences. So let's take a look at how this played out at the Michael Smith Foundation. If you remember this slide from what Gayle presented before, with all of the folks in the organization that are involved, in our organization, that are involved in delivering the KT program, there's a lot of people. But there are also some really, from the purposes of the evaluation, there are also some really important stakeholder groups that are missing. So for us, our board of directors, that's our board chair, is an important audience with an interest in the KT evaluation. We have the Ministry of Health, who is our funder, a really important stakeholder in our evaluation. Whether or not they're actually involved in doing it, they're certainly important as an end target, the people we want to speak to about our evaluation. And then we're also talking about, there's the KT program beneficiaries. So that can be a wide range of people. So for us, it includes the people who use our KT programs and services, the people they interact with to try and move evidence into practice, all the way to the end user. So that is the patients and the public who benefit from faster and more effective knowledge translation. So we have a lot of people who are potentially interested in this evaluation. But in the end, we decided that we couldn't satisfy everybody. If we tried to please all of the audiences, we would probably end up not pleasing the most important ones. So we decided that the KT unit, who's the kind of the lead group within the Michael Smith Foundation, would be the primary intended user for this evaluation, because they're the ones who are going to lead and coordinate the KT effort across the organization, and they're the main people coordinating the evaluation. The strategy team, those are the folks that that organize or design our funding programs. They're a secondary user because they're, as I said, they're the ones that design and evaluate the funding programs with input from the KT unit. And the third really critical stakeholder is the BC Ministry of Health, our funder. We don't expect them to be involved in the evaluation itself, but really at the end of the day, they're the ones that we need to tell our KT story to. So at this point, we're just going to pause and reflect on our process for clarifying the KT evaluation purpose and our key stakeholders, because these are some of the challenges that you also may find or have found if you've done this yourself already. So we kind of started with, as I said before, we should do an evaluation of our whole program. And we had to really do quite a bit of work to really nail down, but why do we need to do that? What purpose it's going to serve? And we also thought, well, if we're going to figure that out, then we need to ask everybody what they think. So we did. We didn't ask the BC Ministry of Health what they thought about this, but we asked widely within the organization. And then we really had to decide which stakeholders' interests mattered the most, and from there being able to narrow down to the most important purposes. So I guess one of the things that happened, being a research agency, of course, we have lots of people who are interested in research as well. And one of the things we wanted to explore in this evaluation was, testing the model that Gayle showed you earlier about the 5 functional areas of KT. There's certainly some interest in exploring that, but we had to decide. It ultimately ended up in our list of purposes for the evaluation, but it's a long way down our list of prioritized purposes. And we will, be able to provide input to that as far as possible, but it's not a primary purpose. And we're really just going to focus on these 2. So the first one is to enable the foundation to report to the provincial government about the impact of the Michael Smith Foundation's investment in KT. Secondarily, we want to generate evidence that's going to help inform the development of future KT program activities for the foundation. So those really are our 2 key purposes. So moving on to step 3, one of the really important things you need to do is or that you might need to do, is to describe your organizational KT program. You need to, because you need to know, well, what is it exactly you're evaluating? So it sounds like that should be really obvious, but once you start getting into it, you discover, or you may discover, that it isn't. Firstly, I guess because it's more challenging to evaluate an entire set of KT programs rather than a single program, because you have to understand firstly how all of the individual pieces work together. So how individual KT activities work together to form your organizational KT program. So often at the level of individual KT programs, you might have done quite a bit of work already to articulate the goals and objectives and how your individual KT activity is going to meet those goals. And there may even be an evaluation plan for individual KT programs or projects. But all the pieces of an organization's KT program may have developed organically. Ours certainly have, sometimes with different funders even, which means that there's often no unifying or overarching goals for the organization's KT program or a clear understanding of how the pieces are meant to work together. So you might need to do some work to define this. You might also have to decide if you're going to include all of your organization's KT activity. So the easiest way to illustrate this might be to look at the Michael Smith Foundation example. So the first thing we had to do was to clarify who does what. So as we mentioned earlier, we decided early on, based on our evaluation purposes and also the resources we had available to do the evaluation, which is an important consideration, that we weren't going to try and include every single piece of KT activity that the organization does in our evaluation. So for example, we decided not to include the KT activities of the President's Office, nor the activities of our communications team. We really wanted to focus on the work that the KT unit and the KT strategy team are involved in. And we had quite a bit of work to do just to clarify those boundaries. So we ended up thinking about spheres of control versus spheres of influence. And that really helped us to map out each unit's areas of responsibilities and how those related to the 5 functional areas in our model. The second major piece of our evaluation work was to develop a logic model to explain how all the pieces of our KT program, or at least the strategy team and the KT units pieces anyway, fit together. So if you recall, Michael Smith Foundation does a lot of things other than KT. And we were lucky in that our organization already had an overarching evaluation framework that covered all of our activities and not just KT. We also had an organizational logic model. So it was important for us to use that as a starting point to make sure that our KT evaluation story was going to feed into the broader story of the foundation's impact. So now don't worry if you can't read or don't have time to read all the fine print here. That's really not important. The point is that we mapped out our KT activities in terms of who's responsible. So the purple is the strategy team and the red is the KT unit. Which parts of the model the activity relates to. What is actually produced, that's in the output section. Who we reach. And then the short-term, medium-term, and longer-term outcomes. We'd be the first to admit that this logic model doesn't reflect complexity, and in fact that's something that we often hear, the complaint about logic models generally in this kind of area of complexity, because it doesn't reflect feedback loops. It also doesn't show assumptions that underpin our thinking. But as a way to structure our thinking for the organizational KT evaluation, it was extremely useful. So again, some reflections on, defining the KT program and some of the challenges we faced and that you might also in your situations. So what we had to start with were our organizational evaluation framework and logic model. You might have that, you might not. You might have something else that your work needs to fit into. But we had something to start with anyway. Their challenges were that there were lots of hands in the KT pie at the Michael Smith Foundation, as we said before. So trying to sort out all the pieces was challenging, and having to say no to some areas and say, yes, of course we would like to include that in evaluation, but we just can't include everything. So it was a challenge to articulate the short and medium-term goals that apply across the board. And it was really challenging to know when to stop fiddling with the logic model. At some point we had to just say, okay, it's not going to, we could keep fiddling with it forever. Let's just work with this and use that as our starting point. So really our key strategy here was to acknowledge that it's never going to be perfect and it doesn't need to be, but you have to have something to get yourself started. So the fourth step is developing evaluation questions. In other words, well, what is it you want to know from your evaluation? And the most critical piece here is that your evaluation questions have to flow directly from your purpose. One of the things we found in the past in lots of settings is that there's a temptation to leap straight to indicators. Like, let's develop the indicators, let's figure out how to measure what we're doing, without pausing to think, what is the broader purpose, what are we trying to achieve, and then what questions do we need to answer? So some kinds of examples of the kinds of evaluation questions, you might have questions about what resources went into your organizational KT effort. You might have questions about what was produced. You might have questions about who you reached. You might have questions about how it was implemented. And you might have questions about what happened as a result. Those are just four broad categories, and I'm sure that there are many. The other thing we should just mention is that, again, you can have a list as long as your arm of evaluation questions, and you need to consider your budget, because the more questions you have, probably the more resources you're going to need to do this. So Michael Smith evaluation questions we had high-level questions and then sub-questions. So our high-level questions really, one was focused on outcomes and two were focused on process. So the first one is how effective is our program in achieving short and medium-term outcomes? And again, we referred back to the logic model to help us, identify what those were. And then the process questions, what factors contribute to the success of the program? So obviously those are things we need to keep doing in the future. And how could the program be improved? So I'm guessing most people are going to be more interested in the questions, the sub-questions that are about outcomes. So these aren't all the questions, some of the selected ones. And again, they map directly back to the outcomes we defined in our logic model. You'll also see that we use this framework of reach, usefulness, and use. It doesn't cover everything, but it was a way to conceptualize and kind of group our questions. So reach is probably fairly self-explanatory. You want to know how many people and which target groups your programs reached or used, and how many people were reached indirectly by those programs as well, if you can. Useful covers dimensions like relevance and quality and satisfaction. And then for us, use covers generally use covers what happens afterwards. So for us, it was really, has our KT program actually influenced changes in individual behavior or system behavior? And then finally, it's important to ask the question for us, what were the unanticipated outcomes? I think it's generally a good question to include, especially in a complex area or in a system where a complexity system, because if you don't allow for unanticipated outcomes to emerge through your evaluation, you might miss something that's really important. It could be both positive or negative, but you're certainly going to learn from asking that question and including it in your evaluation. So again, what were our experiences of developing these questions? What we started with was a massive, long list of questions. Again, thinking came from all of our different stakeholders, lots of things that people wanted to explore. And just like the purpose, the challenge was narrowing those questions down to a manageable set. It's still bigger than we would like. It's still maybe not as manageable as we would like it to be, but we will find that out when we get further into implementation of it. So even just getting down to what seemed to be a manageable set was a challenge. So our strategies for this, we kept referring back to our prioritized purpose list to see how well each question is going to help us address those two key purposes. We checked in with our budget reality, and we had to just let go of some things that we really would have liked to explore, but just thought we just can't do that. So step 5 is defining your indicators. This is really the million-dollar question. How will you know the answers to your evaluation questions? So you need to define your indicators. And when people are talking about KT evaluation, this is often where the conversation starts and then gets stuck. What is a good indicator for measuring progress in your KT program? Asking what's a good indicator to measure progress of your entire KT program takes that difficulty or that challenge to a whole new level. So, but firstly, let's just be clear on what an indicator is. There are lots of definitions, but I quite like this one, which is from the Centers for Disease Control and Prevention, which is it's a marker of accomplishment or progress. It's a specific, observable, and measurable accomplishment or change that shows the progress made towards achieving a specific output or outcome in your logic model or your work plan. So that assumes you have a logic model or a work plan, but you may have you'll have some kind of framework to refer back to. So this is where your evaluation questions are so vital, because if you don't anchor your indicators against your evaluation questions, two things are likely to happen. Either you end up measuring what's easy to measure, but not actually all that important. For example, just focusing on how many events you ran or how many people participated. Or you get totally bogged down in trying to figure out how you're going to measure something that is not as yet quantitatively measurable. And it paralyzes you, and the whole KT organizational evaluation exercise goes into the too hard basket. So I want to point out there, we have this mnemonic that I'm sure many of you have seen, the SMART. These are how you identify this is what's a good indicator. It's SMART. So that's great, and that's what you want to shoot for. But I think our experience would be, well, if all of your indicators have to meet every single one of those criteria for this kind of evaluation, you may not get it off the ground. So absolutely shoot for those, but we would say let's also be realistic about what we can, how we define our indicators there. So parallel to that is, okay, if we're going to have these indicators, we need to figure out, well, how are we going to collect and analyze the data? So you're going, at this point, you're identifying the design, the methods, and the tools that you're going to use, because otherwise the indicator is not much use. So this is where we really have to get creative. And so depending on your evaluation questions and your indicators, your overall design could theoretically be entirely qualitative, entirely quantitative, or mixed methods. But if we think about the types of evaluation questions you're likely to be asking at the organizational level, in most cases, a mixed methods approach is probably going to be your best bet. That doesn't always necessarily satisfy all of your key stakeholders, because people are always wanting the numbers. What was the measurable impact of your program? And so you might have to do some work to convince them of the value of a mixed methods approach. In terms of methods and tools, and this is, again, where as a community of practitioners, we really need to get creative. So here's a sample of some common ones that you might find, or you might find useful. So here are some, again, just some against our selected outcome indicators, some methods and indicators, methods and tools that we used. firstly, as you can see from the methods and tools column, we did end up adopting a mixed methods approach. We're collecting and analyzing quantitative data where we can, and using qualitative data to understand the story holistically. And to be honest, we are relying on qualitative methods quite a lot to fill in a lot of gaps as well. So we recognize that, you know, we would really like to do more things, find out more using quantitative data and tools, but we also recognize that we simply don't have those at this point. You can also see how we've operationalized our reach, usefulness, and use framework in the indicators. As I said before, they're not perfect. There's certainly one missing. So the target group self-ratings related to changes in awareness, knowledge, skills, and positive attitudes, that's more about learning, and it doesn't fit nicely within that the framework of reach, usefulness, and use. But it is a useful, generally a helpful way to think about areas that you want to target. So again, our process for developing indicators, methods, and tools. What we've had to start with was a lot of literature that we didn't find very helpful. So what I didn't mention before was we actually started out our whole process of doing the evaluation, doing a limited environmental scan. So we're not going to pretend that it was a full literature review, but we did do a pretty decent environmental scan to try and see, particularly to help us with this section on developing indicators, tools, and methods. And we didn't find a lot that was helpful. We found examples of things that were useful at the KT program level, so individual programs. So if you happen to have a program that is like the one that is in the literature, that's fantastic. But we're trying to do this at an organizational level, and we just didn't come across really anything in this area that we could use. So this was a big challenge for us. Our biggest challenges, if we have to identify the specific areas, were tracking secondary reach. So what we mean by that is we can pretty easily determine who we reach directly, but we don't know who they then reach, which is the whole purpose of what we're trying to do with our KT program, is to influence people beyond the immediate ones that use our programs or are engaged with us. So we don't have a great way of doing that yet. And the indicators and tools for measuring use, in other words, what actually changed as a result of people engaging with our programs, we don't have great indicators and tools for those either. So our strategy, really, we're still in the early stages here. We recognize that in the early stages of doing our actual organizational KT evaluation, there's going to be a fairly heavy initial emphasis on qualitative methods. But what we're hoping, so that will, and that's not necessarily a bad thing, because we are expecting to get some very, very useful data that way to tell our story. But we do also hope that as we roll this evaluation out, that we're going to be collecting data qualitatively with a view that it may eventually inform the development of quantitative indicators. So the final step in the process is, and we're talking to a KT audience here, so I'm sure that we're probably preaching to the converted, but this is not what you want your organizational KT evaluation report to look like. So we still feel compelled to point out that you need to be thinking right from the beginning about how you're going to share the lessons learned to ensure that the results of your evaluation actually get used. So some of the things that you can use or we've seen used, we have one thing which is no report without a presentation. At least that's a very basic thing that you can do, but it's something you need to be thinking about right from the beginning. So overall, our key lessons learned.
So we sat down and thought about these just yesterday, in fact, trying to prepare for the webinar, and what were the key things that really sort of came to top of mind. The first, it takes a lot of time to develop a KT evaluation framework, especially for an organizational program with lots of activities. So we recommend don't rush the process. Just take your time. You will get there eventually. And if you don't have an in-house evaluator who can spend dedicated time on developing a framework, then I would highly recommend that you hire someone. That money will be very well spent and help to inform not just your story, but where you go forward on your activities.
And I guess from the external evaluator's point of view, I think it's really important that we just can't wait for it to be perfect. As I said, we did do, quite an environmental scan when we started on this for things to help us in developing an organizational KT evaluation framework, and we just didn't find very much. If people out there know of resources that we missed, well, fabulous. I'm sure we would all like to hear about them. But we think that it's important. You just have to get started somewhere. And so that's what we're doing. That's been our approach to this. We know it's not perfect, but we are going to get started, and we expect that we'll learn a lot along the way, which we can implement, which we can use to improve our evaluation in subsequent years. This is not something that we're planning to do just once. We want it to be an ongoing evaluation of our work. So we think that if we get started, we will learn enough that will help our future development.
Okay, thank you for a really engaging and insightful presentation. Now I invite any questions that people have. You can write your questions in the chat box, and Megan will send them on over to us. So feel free to do that. And I have a question to start with. So, Penny, how do you proceed if you have some really surprising outcomes as you're gathering data from stakeholders? So there's unintended consequences of a KT intervention, or something that you thought was successful and it's really not, or stakeholders identify an activity that you didn't think to include in your logic model. Do you go back to the logic model and readjust, or do you just proceed and then add those things in your next round of evaluation? Okay, so that's a good question. I think to clarify, we are, there's the evaluation framework, and then there's the actual evaluation. So you're talking about what happens once you have started on your evaluation. So yeah, I think you can, that is one of the reasons to ask in one of your evaluation questions, what were the unanticipated outcomes? It doesn't have to be outcomes, but what was unanticipated, so that it allows those findings to emerge, which you then can feed back, absolutely, the next time you come to do your evaluation. So the logic model is a tool. It shouldn't be a static tool. It should be, whatever you use, whether it's a logic model or some other model, it should be something that is constantly evolving to guide what you're doing, to be clear about what you're doing, and then the next time you go to evaluation, you refer back to it or you modify it so that it's up to date and you can keep using it. Great, thank you. Okay, so how important is it to have, and this is probably a question for Gayle as well, how important is it to have an external evaluator? So you don't have the budget internally sometimes, and sometimes there's not a dedicated evaluator within a smaller organization. How important is it to go outside to have somebody evaluate from externally?
Well, I would say that there's no one in the foundation when we started who had that evaluation lens, and we do have some staff now who have been doing great work around our organizational evaluation. They don't have capacity to actually take on this extra work, and part of it is because evaluating KT activities are really, really challenging, and it's a field in itself, in my opinion. So the evaluators that we have worked with in the past and we have currently on staff, great. They need to have that dedicated time to dive into this and really learn the field in order to actually develop what this framework looks like and how to go forward. And if they have that, that's fantastic. But if you don't have that capacity, if you really want to evaluate, you have to go and find someone who's got the time and the experience and the knowledge to actually dedicate to do this kind of work. I think it was incredibly valuable for us. We've been wanting to do this for quite a while. It's always like most things, it kind of falls off the side of your desk because evaluation is never the top of priority, even though you want it to be. But I think it's really critical to get someone who is really interested and passionate and working with you to kind of carve out this very sort of fuzzy area that we're hoping through the work that we're going to find out and through others do, that becomes a lot more clear on how you go forward on evaluating KT programs, particularly at the organizational level.
Great, thank you. So a question we have is, what was your time frame? You said take your time, but how much is too much?
So I think Gayle and I probably both have a perspective on that. I think that comes quite nicely from Gayle's response to the last question, is that you have to, so firstly, if you have a significant prompt coming from outside, like you suddenly have your funder saying, we need an impact report and we need it tomorrow, then, you've got to get on with it. So you can, to some extent, it depends on what kind of external pressures you have. But I would say this has been going on, for us, it's probably too long, right? Like we started this when I was still with the foundation. We got started in probably 2015. And we developed, the framework was done by the beginning of, or by the middle of last year. But it did take all of that time that it took to develop, the clarity around what exactly are we measuring, what exactly are we evaluating, why do we need to do this, and developing the logic model. I would say that was time really, really well spent, because I feel like now we're set up to do it. But it really depends on what kind of external pressures you have for evaluation.
Yeah, no, I agree with what Penny's just saying there. It's like we've wanted to do it for a long time, and everyone's busy, and it's really hard to find dedicated time to do this. But we in 2015 and over last year, we made this one of our priority areas, and we cut back on other activities to enable to have the capacity internally to work with Penny on developing this whole model and framework. And I'm really glad that we did. It's going to help to show us if what we've been doing is the right thing. Are we actually down the right path? So it's great to be out there and doing lots of activities, but if we can't show that they've been worthwhile, then I think we kind of have a bit of a problem there.
Great, thank you. So question, would you be able to share the lit review of the KT indicators? So I guess the environmental scan that was done for Michael Smith?
Yeah, we can. So I just need to be clear about what it is. So it wasn't just about KT indicators. It was at the, in fact, that's the section where everybody wants there to be something that's not there. But there is the purpose of the limited environmental scan was for framing the whole organizational KT evaluation and the approach, not just, and what you're trying to do, not just the indicators. So there's certainly a section in there about KT indicators, but I'm afraid it doesn't tell you what you want it to tell you, because we didn't find much at the organizational level.
Great, thank you. So what have you had the experience of, where there's conflicting purposes between stakeholders? So you're reporting back to the board because you want to justify your KT program and the dollars that are going to that, but you also want to report back to your KT community stakeholders to see if the program is actually worth doing. Have you ever had those two, and if so, who do you choose?
So not so much conflicting purposes as multiple purposes, and you need to decide which is the most important. So I don't know that there's a magic answer to that. For us, it was fairly clear. Like after all that discussion, the top purpose was we need to report to our funder. So really, that's going to trump, if there are multiple purposes, that one is going to trump the others.
Okay. Great, thank you. Okay, so how long was the KT program in place before you decided to evaluate it?
We started the program in 2010, and right from the beginning, we've always wanted to do something around building an evaluation, and we were doing that at the project level. But then as we developed more and more programs that would match against our KT model, we just sort of got busier and busier and weren't able to get much further with that. So I would say that it's been about 7 full years we've been doing the program with evaluations of activities along the way, but this is the first time we've actually been able to go in at the program level. And we've just actually started the qualitative interviews and looking at the data now just within the last 2 weeks, I'd say, to see what it's going to look like. So I'm very excited to find out probably by the end of May when Penny gets the report back to us how we're doing.
Great. Okay. The next question is, can you speak more about measuring secondary level engagement, if indeed you were able to do that?
Right. So as Gayle said, we haven't actually implemented the framework yet, so stay tuned for that. Our plan at this point is really to use it's going to be self-reported. So we are very simple. We're doing key informed interviews with people who are, we're calling them KT super consumers. Some of them may be on the call. Be warned, we're coming. So the people who really are deeply engaged in KT work and change generally within larger organizations. So we will be asking them for their thoughts on how that's working. The second piece, following those, we're going to do a larger survey of our whole, I won't say our whole, but quite a substantial number of KT program users, and we will be basically asking them to self-report on what changes or what level of engagement they've had beyond after their initial engagement with us, what's been their engagement beyond. And so we will also, that's also our plan for trying to tackle the questions around use as well.
Great, thank you. So this probably could go to either Gayle or Penny. How do you account for the historical changes in the organization?
That's a really excellent question. So another reason why it's important why quantitative measures are not always going to get you what you need, because they're difficult. It's difficult to account for those kinds of things. So I guess part of the thing we're going to do is we are going to time limit. We're not going to do an entire retrospective on 7 years worth of KT at the Michael Smith Foundation. We're really going to focus on the last 3 years where the program has been fairly stable. We've introduced some new things in the last year or two, and so what we're going to do going forward, so we're going to evaluate the ones that have been in place for a while, and the new ones that are going to be developed, we are evaluating those. So there's a work plan that involves an annual data collection. So we are going to include those new activities as they come on board, and they will just become part of the story. They won't be part of the story in the first round that we're doing, but we expect them to be part of the KT story in subsequent years.
Okay, thank you. I think that's probably all the questions we have. So I'd like to thank everybody for attending this webinar, and I thank very much Penny and Gayle for a really informative presentation. I didn't think there was anything left for me to learn about the Michael Smith Evaluation Framework, but I have, and it's been really great for me too. So I'd like to remind everyone to email Megan their evaluation forms, or please complete the online evaluation. The next session of the KT seminar rounds will be on April 12th. We're featuring Alison Hoons on the topic of knowledge brokers, and that will be a great one. So thanks everyone for coming, and you can sign off as you will.
Thank you very much, everyone.